All right, welcome everybody. My name is Kyle Magatelli. I'm the social media coordinator for the Student Doctor Network, and I am very happy to be joined today by Dr. T. Nguyen, podiatrist. Dr. T, thank you for taking the time to talk with us.
Thanks for having me, Kyle. I'm excited to be here.
Absolutely. So we've got a really cool topic today, and this is one that I had absolutely no idea was a thing. Dr. T, you have a cash-based practice as opposed to going through insurance.
I do. It's called direct care, and it's actually a social movement away from the insurance-based practices because we're just kind of fed up with the way the insurance system is ruining what medicine is. It's a relationship between patients and doctors. And so those of us who call ourselves direct care doctors are trying to reclaim that time and autonomy in our private practice model.
Okay, very interesting. And again, I had no idea that was a thing. So I'm looking forward to learning more about it. Before we kick off, I want to run through real quick some of the resources the Student Doctor Network has for pre-med and health school students. So free resources, best thing to do, go to studentdoctor.net. At the top, there's a resources tab, way better than me just talking about it. The confidential expert advice forum, that's within our forums. We're best known for our forums. We have a variety of other resources we offer. But within the forums, if you need a direct answer from experts, these are vetted experts, AdComs, attendings, etc., you are going to find out the information that you need. The Pre-Med Planner app, this is a great way. Hey, you can take this from day one of undergraduate to when you submit to AMCAS. A really nice feature in there is the clinical hours tracker, because the absolute last thing you want to do is lose track of how many hours you've put in. The medical school application cost calculator, we all know that applying to health schools, medical school is expensive. This will help you put a budget together ahead of time. Do not leave that until the last minute for sure. Our YouTube channel has a wide variety of webinars with providers. We have a couple with the AAMC on financing your medical education, how to get to med school. Go to our YouTube channel. Please like and subscribe if you want more free resources and content. MD applicants, you can find out how you stack up against other applicants with mdapplicants.com and the Lysium application assistant. This is essentially, well, there's two links. So it's a two-stop shop on finding out where am I competitive, how am I looking compared to other candidates, what are they doing that I'm not, etc. Essay Workshop 101 is, well, if you need some help on writing your personal statement and all those secondaries, this is a great place to go. It's if I remember correctly, 6-part series. It'll take you from pen to paper to finished. And review 2 is test site reviews. The last thing you want to do is go to take your MCAT or what have you and find out, oh, it's 50 degrees inside the test center. So hop on there, find out ahead of time, and you can find us on all the socials. Thank you for letting me run through that. And more importantly, Dr. T, I'm going to hopefully not mess up the layout. There we go. All right. So if you could, please tell us a little bit about yourself.
Hi there, I am Dr. T. Nguyen, and I used to use SDN myself right in the pre-med stage before I decided to go into podiatry school. I am located in Santa Cruz, California, and I opened my private practice in 2018. It was insurance-based. So I had to go through a lot of the paperwork that's involved with getting credentialed with insurances, and that could look like getting on their credentialing team anywhere from 30 days to 9 months or so. And it was laborious, and that should have been a key indicator of that it was not going to work for me, because that waiting game was just really exhausting. But I did a bunch of that in the beginning. And then that was also the same year I had my daughter, and I had worked in an employed position previously, but it wasn't really favorable to deciding what my schedule was going to look like. When you work for somebody, you just show up and do as you're told. And I figured that wasn't going to be my lifestyle with a newborn. So I decided to open my own practice the traditional way. And then 2 years later, I realized how expensive it was just to maintain my private practice that way, and decided to start pivoting out. So as of 2022, I became completely cash, and now we're in 2023, and I'm sharing my journey with everybody else who's interested in private practice with the direct care way through my podcast. And you can find more information about that on my website at teadpm.com. So that's where I'm at today.
Okay, cool. So first question, and you got a little bit into this, tell us about having a cash-based practice as opposed to working with insurance providers.
The insurance based model is expensive because you have to maintain number one contracts with insurances. You have to read through the relationship you have, and with that contract you have to understand what they're going to pay you. There really is no negotiating what they'll pay you. You can bill out whatever costs you think you want to charge, but that doesn't necessarily mean you'll get that at 100%. More often than not, you're going to get 60% of what you want to charge. So that's what it's like working with insurances. Not only the lower reimbursement rates as they continue to decline, this year, many insurances are saying that they're going to decrease the fees paid to the physicians. And so we're kind of bound to that contract. We have no choice in the matter if we continue to have those contracts. Versus a cash practice where people know the price of everything and they can choose to go to you or not. It's very much like going to the grocery store. You have the freedom to choose what products you want. You know the cost of things, it's clear, and you go to the checkout line to pay. It's a very easy transaction. There are no contracts involved. There is no confusion. There is no need to add to your overhead expense in dealing with accounts receivable, money that's owed to you but hasn't been paid out. Sending patients to collections because nobody knew the cost of things. Nobody knew how much to collect because each individual insurance contract is different, and each carrier, each dependent have their own deductible. So then you have to pay for staff to understand what they even need to collect before the visit for their appointments. So you can see it's pretty convoluted in the way we deliver medical care in the insurance-based practice when we're relying on a third party to pay the physician versus the direct interaction between the patient and the physician, where both parties know exactly what they're entering into and can choose to stay or not.
I did not know most of that regarding how the insurance part works. It sounds like dealing with vendors only about 1,000 times worse. Jeez.
It's 1,000 times worse, and everybody wants a piece of the pie. And it's always, at the end of the day, the relationship is between the patient and the physician. And it gets more and more diluted the more people who are interfering with that care.
Okay. Next question. Again, you got a little bit into this, but when did you decide to adopt this business model? You told us 2020. I'm wondering, what was kind of the tipping point? When was it that you said, okay, enough is enough?
2018, I was really excited. I was determined to learn everything about business because we don't really get that training in our medical practice, in our residency training, or even in school. So I was really motivated to learn what everybody else is doing. In 2019, I was financially sinking faster than I knew how to replenish the revenue. And I had to figure out what was happening. Was it me? Was it because I was overspending? And what was I overspending on? And I found that all of the expenses had to do with the insurance things. It was the billing software, it was the biller, the people who had to deal with the accounts receivable. It was my staff, because in the traditional insurance model, you're on the regular double or triple booking because the no-show rates are really high. People don't take responsibility for their appointment times, and if you don't have a policy in place to protect your time, then people can choose not to show up without penalty because they're relying on their insurance to pay for everything. And so the tipping point for me was when I started to receive these checks that were at 1 penny. I think the other one was 2 cents, and then the other one was 5 cents or under 10 cents. Were these individual checks that were mailed in individual envelopes from the insurance company. And then I thought to myself, how ridiculous is this? How expensive is it to mail out these checks from these insurance companies? They're not being responsible about how they're spending. So who's to say they're going to be responsible with the money that people pay into their premium as well? And so these are just added agitations that I had. Not only was it expensive, I wasn't really enjoying what I was doing because I had to do the administrative work that was required to get paid. And then the insurance says, we'll pay you whatever we want to pay you. And we had no choice in the matter. So if we maintained that contract, it was very heavy-sided to their favor. And so I didn't find that to work for me. And so I started looking at different ways to practice medicine in 2020.
Okay. This is a lot of things that I did not know. I mean, I have a background in business, and everything you're saying is just like, oh man, Yeah, you don't learn that unless you're actually doing it. That's all there is to it.
Exactly.
So, and again, this dovetails from what you were saying. So, what was it like working with insurance providers? We got a little bit on that, but if
Yeah.
is there more?
So insurance is a beneficial thing for catastrophic events, things you can't predict. It's a financially protective way to get medical care without having to tear into your financial pocket, right? We need it for certain events. So even though I'm a cash practice, I do recommend people having some level of catastrophic health insurance because we just can't predict when you're going to have a stroke, get into a car accident, or have a birth defect, for example. So those are very useful places for insurance. However, for many of us who do elective work or preventive care, there's a lot of limitations. So working with insurance as an individual practice owner was not entirely feasible for the work that I wanted to do. I wanted to be able to give better care, faster care, and the only way to do that was to take away the administrative stuff that I was consumed with and actually spend time with the patient. And that can look like a 30 to 60-minute appointment versus the insurance-based way. We were getting paid really low, so we had to see more people, and oftentimes we had to double and triple book. And that time gets condensed down to maybe 5 to 7 minutes face-to-face interaction, with the remaining time dedicated to staring at our computers, writing our notes, figuring out the billing codes, and then sending that off to get paid. So working with insurance as a private practice owner, as a podiatrist, there were a lot of limitations that didn't really allow me to get patients better faster. There was all this other stuff in between. And I found that to be very disheartening. And it led to a lot of my colleagues to burn out.
Okay, yeah, from a cost benefit side of things, the time spent for uncertain payout. Okay. So, what are some of the benefits for providers compared to a traditional practice? And what are the main things you would say? Okay, here's the best parts.
The benefits for physicians compared to traditional practice, you mean for direct care?
Yes, that's right. You worded that
The
much
ben-
better.
yeah, the benefits to direct care practice for a physician, I think it's very obvious when you're in it. It may not be obvious because when we're functioning out of the insurance-based practice, we think medicine's supposed to be convoluted. It's supposed to take 3 months to get paid, right? We're kind of like brainwashed to believe that this is a normal system in business. But in reality, when you enter a cash-based practice, it's just easier. It's lower stress because you're not needing to double or triple book when you're charging what you need to charge to sustain your business. You don't have to worry about extensive overhead because you're not having to pay for somebody or a billing system to chase the money that's owed to you. The transaction is immediate. You want something, you get the payment for it, and you exchange that for the service. So you don't even have to track money that's owed to you. It gets paid the same day. So from a stress point of view, it's a lot more rewarding because you're giving a service that, excuse me, because you're giving a service that you want to give and you're getting paid what you want to get paid. So in itself, that model provides freedom in your time. You're not having to double book, you're not having to take charts home and taking work home into your private hours to accommodate the insurance needs. You're just having a practice in direct care where it's a cash interaction. You get paid for what you want to do, patient gets what they need out of the service, and it's a closed deal. So I believe that direct care is a lot less stressful than the insurance-based practice.
So you mentioned double, triple booking, taking charts home. So if I get this correct, you can have situations possibly where you have multiple patients showing up at the same time, and then you still have to go do your notes at home.
Yeah, that is very typical. And it's very typical that people, if they show up late, they bounce your whole schedule. They push all the patients after them. It's very typical to see 30 to 50 patients a day for one single physician in the insurance-based model because they're pumping patients in so that they can generate money out. And we're treating medicine as kind of a assembly line in the insurance-based model in private practice.
Okay. So what are some of the benefits for patients with the cash-based model?
If you've never had experience with accessing medical care, this may not make a lot of sense, but if you've had at least one interaction trying to see a doctor, you'll know the experience. The experience is usually a phone tree. It takes a long time to get a hold of somebody on the phone. It takes a long time to make an appointment. It's usually weeks to months out. When you have that interaction, it's short, 5 to 7 minutes. Maybe the doctor's looking at you, maybe not. Maybe they're strictly looking at your lab, but they're not listening to what you have to say as a patient because they're busy doing these metrics. The benefits for the patient in a cash practice is that they know what they're going to pay for. They never get a surprise bill months after the fact, months after the insurance processes what your deductible is, what your copay is, what your coinsurance means, all of those things. You know, the patient knows exactly what it's going to cost to solve their problem upfront, and there's no surprise bill. And I think that's one of the biggest benefits. Second, they get immediate access to their doctor. Once you establish care with your direct care doctor, they know you. They know your entire medical history. You don't have to repeat your story over and over again. And if you have to be seen urgently, they can usually accommodate that. I can accommodate my patients within 24 to 48 hours if there was an emergent situation. So that can relieve or alleviate the strain for patients going to an urgent care center or emergency room, having to wait hours on end for an infection, for example. Oftentimes, what we offer outside of the insurance-based practices are more innovative treatment, things that aren't even covered by insurance. People have the misconception that insurance covers everything, but we know a lot of the more advanced treatments are not covered and they're beneficial for patients. And patients are naturally wanting to look at alternative modalities to help them get better faster. And so they're seeking for products that are on the market. So if private practice physicians want to adopt some of these technologies, then patients are already wanting to pay for them. And so that is an added benefit to going to a direct care doctor because we're ahead of technology and offering it before insurance even decides to pay for it.
Interesting. So just out of curiosity, what is an example of a procedure or technique that insurance companies haven't caught up to yet that you do?
Yeah, there's PRP injections. If you've heard of PRP, it's
Okay.
when they draw blood from you, they spin down the platelets. There are growth factors in there that's used from head to toe, from hair loss all the way down to tendonitis in the feet, the foot and ankle, for example. And that can delay or even prevent the need for open surgery. So that is a huge benefit to offering things that aren't covered by insurance that we know has scientific evidence for in helping people get better. So that's just one modality. Things that I do specifically: preventive foot care, trimming of toenails and calluses. That's not a covered benefit for people who are at high risk for an amputation. That is not covered. And
Okay.
it's a necessary service. And, you know, we have lasers and therapies for pain, musculoskeletal issues that can help people prevent surgeries.
Interesting. Okay, thank you. Thank you for telling me a little bit more about that. And something I'm wondering here, what are some of the things you do to successfully run your practice that differs from a practice that takes insurance?
When you take insurance, people find you because you are in network. So you're within a network of other network doctors. So it's kind of easy to have people kind of trickle into your practice. When you're a direct care practice, you don't have that network. You are a direct to consumer marketing. So you have to learn some business skills, what it means to own a business, what it means to have what it means to have a relationship with the public, because you want them to know and trust you before they decide to even make a payment for your services. So you have to learn the business side of medicine of that relationship. And so the skills that you have to learn is the same as a retail store, for example. You have to be able to convey your value for them to come in and even decide to pay you. It's a little bit more challenging in the sense that we are technically competing with the in-network type of services. So it's really important to figure out what your niche is to make you stand out and different from all of the others so that you're not comparable to an in-network doctor.
Okay, interesting. Yeah, again, running a business is really hard. That's every physician I've spoken to has said they don't teach you guys that in school.
Yeah.
So, next question. If a provider asked you for advice about how to most effectively establish and run a cash-based practice, if they said, all right, throw my hands up, I'm tired, I'm done with this, what would you tell them?
I get this call almost every day.
Okay.
People reach out on my social media, on LinkedIn. I just had one yesterday, and this individual said that his hospital system shut down and now he's going to be out of a job within 4 weeks or less. Can you imagine? So the benefit of having your own practice is that you're fully in control of your business and your life. Yes, it's a little bit harder. You got to learn some business skills. But if you're willing to do the work, it can work in your favor. You're not tied down to somebody else, whatever their agenda is for you. So the most effective way to establish a business is to grab a mentor who's already doing what you want to do, because they've probably already made the mistakes that you don't need to make. And so they've already laid down the foundation of what it takes to be a successful cash practice. So I would start with a mentor.
Okay, perfect. So you mentioned this earlier, and I don't have a nice little question card queued up for it, but you said that this is a social movement. Can you tell me a little bit more about that?
Right. So the social movement of direct care, there are alliances. There are non-profit organizations trying to help the public understand that this is a viable option if you don't have insurance or you want another option for your medical care, versus calling yourself a cash practice or a concierge practice or a boutique. They're all kind of the same thing, a little bit of variations in the way we call ourselves, but we're trying to be less dependent on insurance payments. So if you look at the websites dscalliance.org, that is an alliance for direct specialty care doctors to put all of their information in, and we're just housing all of the direct care doctors who want to push for price transparency and away from the administrative stuff that interferes with the patient care. So that's what I mean by a social movement. We want people to know about this. We want people to know that we are against the hidden fees of what it takes to get medical care, which is the insurance-based practice. And we want to offer transparent pricing so that people can be financially prepared to get medical service. So that's just one part of what it means to have a social movement in medicine, is that a bunch of us doctors, we're bootstrapping all this along. We are openly talking about what we're doing. We're openly talking about the cost of things, so you'll always know what it's going to cost. We understand the importance of having immediate access to your medical doctor, so you're not going to get brushed off, messages sent on messages before you even get the attention of your doctor. You might even access your doctor directly when you call their office, because we don't have to deal with all of the stuff in between. It's just a patient-physician relationship, and then you just pay for the service that you need.
Okay, awesome. So my other question is what kind of growth have you seen within this movement over the last few years?
It has been exponential, and I only learned about direct care probably early 2020 when I was desperately trying to find another way out. And then once I started to one doctor, I needed to find people in my specialty, which was very rare for cash practices to openly talk about their cash practice, because they're comfortable, they're happy, they're doing their thing, they're staying quiet. While the rest of us are kind of suffering and saying, what is the other way to practice medicine? Does it always have to be through insurance, or can we do this, with cash, with a direct transaction? So that is, that's kind of where the transition has been for me, is to find out, other people who are doing it. The growth has been phenomenal, because I think I'm one of a handful of podiatrists who are standing on a platform like this, telling people, yes, you can do surgery and people will pay you cash for it. You can do procedures and people will pay you cash for it. And I think as time progresses, I've seen it exponentially blow up. I'm speaking at more residency programs on a school level, on
Really?
Facebook, on Instagram, on LinkedIn, and everyone who have reached out to me said, I wish I had known sooner about this modality, about this model.
So you mentioned speaking at residency programs. That's interesting to hear. So it sounds like there might be a path forward for students to learn about, or I should say resident physicians to learn about this before they're already in the thick of the insurance mess.
They have to know about this, because it is another way. It's a viable way, and over 40,000 doctors are doing it.
Okay.
And now that we're forming these alliances and now that we're having these open conversations, and now that we see what insurance is doing, they have made a huge profit during the pandemic in the billions of dollars. And yet they still want to cut the physicians' reimbursement rates. So there is a value misalignment in that. So if people start asking questions a little bit more deeply, like why won't anybody know the cost of a CT? Or why is my MRI $1,500 versus one, if I were to pay cash, why is that only $500? Once we start asking these questions, then we start to realize that it is a systemic problem in the corporate side of medicine. And we physicians are not corporate physicians. We are physicians who want to take care of patients. And some of us, most of us, kind of get sucked into the system unknowingly until we pause and take a moment and question, why are we doing the things the way, why are we accepting things for the way they are? Is there a better way?
Okay. Yeah. Thank you for explaining that a little bit better. I mean, as someone myself who's like looking at applying to med school, it's like, okay, I would have had no idea about this entire insurance side of things. I mean, I know I've like seen a breakout before where it's like sailing bag, $200, but to find out, oh, okay, they can reimburse you at a rate lower than what you're projecting, that would rain havoc upon a business. You wouldn't even be able to appropriately project your expenses, or like how much you're going to be able to cover.
Exactly.
Wow. Okay. Well, Dr. T, those are the questions I had. I really appreciate you taking the time to tell us about this. Again, can you please tell us where to find you on socials? And I'll make sure all these links are going to be in the description.
The best way to find me on social is on Instagram at TEADPM. You can learn more about me, my services, and my practice at teadpm.com. I have my podcast. I'm starting a blog. I've connected my clinical practice website so that you can see what it looks like on a patient's point of view. And I also offer coaching if you decided to launch your own direct care specialty practice, but really want some guidance with that.
Okay, awesome. Thank you for taking the time to talk to us about this. Really appreciate it.
Oh, thank you for having me, Kyle.
All right. Thanks, everybody.